Hey Al, Cohen here. So just gonna make a video. I had spoken before that I went to visit the Mclean Clinic in Mississauga, Ontario, where I had had my top surgery. They are now approved for OHIP funding. So what I have done is gone there, asked some questions, got some paperwork, and I'm gonna let you guys know what I found out. So we'll start off at the top. So OHIP agreed to cover the double mastectomy done by the Mclean Clinic. What that means is that the double mastectomy itself, which pretty much every surgeon does, but Mclean has a little bit of a different approach to it. So, what you will be getting from OHIP is the exact same thing that is happening in Montreal, just with the technique used by Mclean. So you'll get the double mastectomy covered, which is the removal of the breast tissue. And if you're getting keyhole, then that's through the scar around the nipple. And then if you're getting the double incision, then that would be the two scars across here with the nipple grafts. Now, myself, I paid for the male chest contouring. The male chest contouring is where they do liposuction around this area under your arms, a little bit here and in the chest, to try to make it so that there is not as much fat there and it appears more masculine. That is not something that OHIP covers. So if you are going through with OHIP coverage, you will get the double mastectomy, which gives you the male chest. But Mclean also offers to have the chest contouring done if you wish your chest to look a little bit more masculine. So with that, you will have to pay an additional $2,000 to the Mclean Clinic in order to get that done, because OHIP does not believe that that is necessary, so they are not going to cover it. Um, it is not mandatory that you get it. It is completely up to you. It is an option that is available, but it is something that you will have to pay for. Personally, for myself, I paid around $8,000 for my surgery, so $2,000 for a little bit extra would be amazing for me. But I know that some people can't afford that, and it's there if you want it. If you don't want it, you leave it. So a lot of people ask me why I didn't have drains. So this is going to be along the same lines as the contouring conversation. So if you have a double mastectomy or the keyhole, usually that's just removing the breast tissue. So there's still fat, and then there's still areas where they haven't gotten rid of some of the excess, a lot of excess skin, or it's going to need to heal properly. So there are little pockets that could possibly have fluid buildup, which is why you end up having drains. If you end up getting chest contouring, because they have removed all the excess fat that they decided to, and that some areas have been tightened up a little bit more, then that actually takes away the risk of having fluid buildup, and it's very rare to have fluid buildup that becomes an issue. So I went through mine, no drains, just a binder for 3 to 4 weeks, and I had no issues as far as fluid buildup. So that is the difference. If you see somebody who has drains with a double mastectomy and somebody who doesn't, that right there is the reasoning, at least for Mclean, why he doesn't use drains if he does a double mastectomy with the chest contouring. So with OHIP, how do you get this coverage? How do you get to Mclean? What you would have to do is you have to go to your doctor, so your general practitioner, nurse practitioner, that is dealing with your hormone therapy, your transition, whichever it may be, and they have to write a letter that expresses that you do need this surgery, it's necessary. And also um, there's paperwork, which I will show you guys. I'll also post it online so that you guys can find it on Facebook if you follow us on Facebook. So if you don't, then you should go do that, because the information will be up there this weekend. But for that, how do you get it? Go to your doctor, talk to your doctor. Your doctor will then have to get the paperwork, which is accessible to them. You can also find it online, and you can also find it through us, because we actually have the paperwork. The paperwork you would be looking for is called a request for prior approval for funding of sex reassignment surgery. Mouthful, but that's what the document is called, that your doctor is going to need to fill out for you. Your doctor will then there's an area on here that asks where you would like to have your surgery. So if you don't want to go to Montreal, but you want to go to Mississauga to see Mclean, then you will have your doctor fill out that you would like to be referred to the Mclean clinic. At that point, they will send it out, and OHIP will get back to you with an appointment date for a consult with the Mclean clinic. So then at that point, you will end up starting to converse with the Mclean clinic once you get your consult there. At this point in time, the rules, from what I'm aware, to this newfangled OHIP coverage, you have to be on T for a year. So if you haven't been on T for a year, then you can't send in to ask for approval. This has been told to me by many doctors. That's what I found online, and a lot of guys are letting me know that that's what their doctors are telling them as well. If this is somehow not completely true, you would have to go through your doctor and ask, because as far as I'm aware, you don't need therapy, so you don't need to go to any therapy sessions. You just need that letter from your doctor confirming, but you do need to be on hormones for a year. I am unsure for guys who are natural transitioning. The Mclean Clinic was unsure about that as well because they don't make that rule. So at that point, you'd have to ask your doctor or question OHIP about that. Because I know a lot of guys out there can't go on hormones, don't wish to go on hormones, but they do want top surgery. So I'm unsure if that is still something that's your own choice to make, since you're not going further on any other medical procedures or medications, which I don't agree with. But at the end of the day, that's something that I believe you will have to speak to OHIP about. Let's see if there's anything else I missed. So they also still do their surgeries in their clinic in Mississauga. They have a complete OR room set up and ready to go. They do their surgeries there. A lot of people think this is weird, but actually it's a bonus, because when you go to a hospital, you're surrounded by a bunch of sick people usually. You could get sick. It's more likely, not a lot, but a little bit more likely that you could end up with an infection or something else, just because of everything that's going on in the atmosphere there. If you go to the Mclean clinic, for instance, and there are other doctors that do this as well, in their personal clinic, it's very hygienic. They don't allow patients to come in for appointments if they're sick, that kind of thing. So the only thing that you're going in there for is what you're getting done, and everybody else is doing something along the same lines, and all the health procedures are followed to a T, so it's amazing. They're super trans friendly. They are super friendly in general. It doesn't even have to be put like, I have to state that they're trans friendly, obviously, but it's just they're friendly in general. They're so giving. They give us the scar gel that we give away every month, and that's 120 bucks. So times that by 12 months in a year, and that's pretty generous. So at this point, we are going to let you guys know that we were told that they are booking into October. So whether you are going through OHIP or you are personally funding your surgery, they are booking into October right now. It's June, so that's 6 months in comparison to other wait lists and things like that. It's about a year for most others, so that's still a pretty good wait list time. It's not too long. A lot of guys are getting in, and from what I'm understanding, as long as the very few guidelines that you follow are done, your approvals are actually getting through super quickly. So you're getting your referral to Mclean very quickly as well. It goes through like that, and then the only thing is just waiting for your surgery date, from what I'm understanding. So it's going very quickly. It's going very well. They're very excited about everything that's going on. So I do have paperwork that you guys will have to fill out. Actually, your doctor will probably end up filling it out, but it's pretty much just letting them know where you want to have your surgery, who you are, the person who's referring to you, and then there's also just asking what you're getting done. So it's very specific. This is the same documentation that would be for a hysterectomy or something like that if you were going through for approval. There are pages that you do not have to fill out, so make sure that you go through them. If you start seeing things that you're like, I'm not getting that done, don't worry, you don't fill those pages out, and your doctor should know that as well. So it's not too long. It's about 7 pages. I think about 2 or 3 of them, if you are having top surgery, you don't even have to fill out. It's pretty straightforward, pretty easy, so hopefully everybody will be getting on the Mclean train and, you know, showing some love to some Canadian surgeons because right now in Canada there are not a lot of surgeons that do um, top surgeries, bottom surgeries. There's like one that is covered. So it's one of those things where all of these surgeons are kind of out of our reach. And because we would have to travel, even if we did travel, it might be cheaper somewhere else. But once you add in our travel and everything, it's pretty much the same or almost cheaper if we stayed here. And Mclean is such an amazing doctor. He has such an amazing result that honestly, I couldn't even fathom. I had everybody telling me to go to Dr. G in Florida, and after I thought about it long and hard, I met with Mclean and I talked to some other guys. It ended up that I was more impressed with the work that Mclean does, how he does it. There are no stitching on the outside. It is done on the inside so that it's a closed seam, and there's, in my opinion, not as big of a scar left over. I have not seen too many large scars on guys that have come from Mclean. I haven't heard a lot of bad things, not a lot of revisions. If they are, they're very, very small revisions that are done. And even that, I'm not sure about this. Do not quote me, but I do know for myself because I paid out of pocket. Revisions are covered. So if I went in and said, "Well, I feel like I have a dog ear right here," he would do that, and I wouldn't have to pay for it. If there was something else that bothered me, like say that something else that he could fix that would be considered a revision, he would do that for free if you went to him for your original surgery. Now, as far as I'm reading from some information I got about the OHIP coverage, what it is saying is that OHIP will cover your revisions, but what you do have to do is you do have to reapply to OHIP for your revisions so that they can send you back so that it's all done properly. Um, I think that's about it. I don't think I have any more information for you guys. One thing I will do because Mclean was my surgeon is I will show you guys what my chest looks like because I think it's a pretty stellar job and I'm so impressed with it that like I can't fathom going anywhere else. That's just in my personal opinion. I have an amazing chest. Everything turned out great. My whole experience with them was amazing. So at the end of the day, if you're a Canadian boy or if you want to come to the north for a really awesome surgeon, Mclean is definitely an awesome choice. I want to say number one. I'm going to say it for me because it is me, my opinion, and my results. In my personal opinion, Mclean is definitely the number one top surgeon in my mind right now. So please feel free to check him out. They are very open. Their consults, if you do not go through OHIP and you just want a consult, those are free. So you don't have to pay for a consult either. Um, I will let you guys go. I hope you guys have an awesome weekend. We will come back at you with some more videos. I'm gonna have, I'll probably talk about my histo and top surgery post-op being however long in one video, and then I also have my 2 years on T coming up, so I'm gonna do that video up. And I think there might be another video about something informational, but at this point, I can't remember. It'll probably be to do with the prides that are coming up because it is Pride Month, and we hope that everybody has an amazing Pride Month. And just be yourself, be proud, and we love you. Talk to you later. Peace.